This next test is called a Worth 4 dot. Why is it 4 dots? Because you'll see 4 dots. Typically, you'll see 2 greens, you'll see a red, and you'll see a white. When the patient puts on their red-green glasses, okay, the red-green glasses means that you're going to put the red lens over the right eye. So think about red with the R, right. Green will be over the left eye. When a patient has the glasses on and they're looking at this, they should see 4 dots. If they have normal binocular fusion, they should see 4 dots. This 4th dot will interchange between red, white, maybe green. That just means that their eyes are being used together, and that's why it will fluctuate. Patients will say this might be red, green, or white. Those are all acceptable answers, okay? So if you're doing this test, you'll have the patient put on their glasses over their correction, meaning that they wear contacts, or if they wear normal glasses, your red-green glasses go over your normal glasses. You'll have them test this at distance. If you're in exam room 3, you can use this, or you can actually use the Worth 4 dot flashlight. You should see a red, 2 greens, and 1 white. However, when you have the glasses on, you'll see 4 dots, and the white dot can appear red, green, or a mix of the 2. Now, as you're testing this, you're gonna have this on. If the patient, all right, is suppressing an eye, suppressing means it turns off. Suppression means turns off. It is suppressed. If there is an eye that is suppressed, for example, if your right eye, which has the red lens over it, is suppressed, you will only see 3 green dots. You will not see any red. Why? Because your right eye has been turned off or suppressed. If the patient says, I only see 2 red dots, that means the right eye is being used and the left eye is being suppressed. They do not see any green dots. That means the left eye is going through suppression. The green eye, the left eye, is not being used. This is common in someone who has exotropia and sometimes esotropia, but more common in exotropia. In the distance, most times the eye will drift out. Therefore, there is an eye that shuts off. If a patient says, I see 4 dots on one side, 4 dots on another side, or they say somewhere between 6, 7, or 8, that means that they are going double. Diplopia. That is the correct term, diplopia. Diplopia is double vision. If they see green dots on one side, red on the other, or a mixture of them, you need to ask the patient, where are the green dots, where are the red dots, and how many dots do you see? This will let us know which eye is causing the diplopia. This is all for distance. In the chart, you will notate how many dots the patient sees, and you will notate if they're going through suppression, and you will notate the eye, right or left. As you move closer, you will now test this same Worth 4 dot test up close, between 40 to 55 centimeters. This will be the exact same way the distance is tested. You will see if they are suppressing the right eye. If they are, they will only see green dots. If they are suppressing the left eye, they will only see red dots. If they are going double, diplopia, they will see between 6 to 7 to 8 dots. You must ask, where are they seeing the dots? However, if they are seeing 3 dots that are green, that means they are suppressing the right eye. If they only see 2 dots that are red, they are suppressing the left eye. This is very important to understand and notate in the chart. You will let the provider know as soon as you finish your test. Thank you.